Hello everyone, good afternoon everybody. I'm Priyanjali from Radiance with You YouTube channel. Today we are going to discuss about our skin health with focus on psoriasis. Psoriasis is a condition in which skin cells build up and form scales and itchy, dry patches. Psoriasis is thought to be an immune system problem. Triggers include infection, stress, and cold. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints. It can start at any age, but most often develops in adults between 20 and 30 years old and between 50 and 60 years old. It affects men and women equally. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis, its types, how we can prevent it, and the kind of test required for its diagnosis, the right treatment, and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Prachi Prashant Mahajan. Is an MBBS, a DDV dermatologist, dermatosurgeon, cosmetologist. She has advanced training fellowship in aesthetic medicine. Her clinic is called Dr. Prachi Mahajan's Skin, Hair, and Aesthetics Clinic, located in Kalyan. She is also working as a dermatologist at Kalyan, Dombivli, and also is associated with many other hospitals in Kalyan and Dombivli. And with that, I would like to welcome her to today's screen. A very warm welcome to you, doctor. Let's begin with the basic information. What is psoriasis?
Yes. First of all, thank you, Priyanjali, once again for a warm introduction. It is really pleasure to meet you. Okay. So today we'll be discussing on psoriasis, and it will be more be a academic session and informative session for both my juniors, my dermatology resident juniors, and also my patients. So, first of all, to start with psoriasis, we'll be discussing. Psoriasis is basically what is psoriasis? It is a chronic inflammatory disorder mostly affecting the skin, joints, and its clinical course is characterized by exacerbations and remissions. Okay. Yeah.
Right. So now, as we all know, doctor, about the formation, what makes it different and distinct? How do we know that this is the condition? What is the identification of the condition?
Correct. So basically, psoriasis age-wise, if we discuss, it can occur in mostly the age of onset can be 15 to 20 years. That is the first onset, and the second like it's not most common, but still it can occur in 55 to 60 years of age also. So the mean age, if we calculate, it is 28 years of age. Okay, most commonly it
Right.
is affecting the second decade of life. That is the affected age can mostly it is seen when we see our patients in a reproductive age group. Okay, so that is
Mm-hmm.
mostly affected. Okay, so this early onset the disease, if it is coming, so now the characteristics of the disease are: first is a red scaly plaque, okay, or a papule which is silvery white in color. It can be seen on mostly anywhere on the body, but especially it is seen on the extensor surfaces, the arms, the elbows, the knees is the extensor area. Okay, and also it can
Right.
affect on the scalp. Fine. And it is more characterized by a myraceous scales. Okay, that is a silvery white scale. पेशेंट विल टिपिकली से दैट कि डॉक्टर खुजली करते हैं तो वहां से पपड़ी निकलती है. सो दिस हिस्ट्री
Right.
generally don't come with the age of onset, the occurrence since last 1 week or 5 days or 6 days. Mostly they come from the onset. Mostly it is occurring since last 1 year or 2 years or 3 years or 7 years, and they will give a typical history कि डॉक्टर आता जाता रहता है, वो कंटिन्यूअसली नहीं
Mm.
रहता है. अ, आता है, फिर थोड़े समय के बाद फिर जाता है, फिर वापस आता है. सो दिस टाइप ऑफ हिस्ट्री द पेशेंट गिव्स. So by this we can recognize that it is that condition or not. Plus it not only affects the skin, it also affects the nails. Okay, so typical finding of
Right.
nails, we'll be discussing it later in our
Mm-hmm.
upcoming webinar, in our upcoming after some minutes. And then it can also affect the scalp. It is in the scalp. If it affects, it's called scalp psoriasis. If in the palms and soles it is affecting, it is called palmoplantar psoriasis. Okay, if in the flexural areas, it is called flexural psoriasis or inverse psoriasis. Fine. In the genital areas, genital psoriasis again. Plus psoriasis generally it is a chronic plaque psoriasis. It is not an emergency, but emergencies can occur in psoriasis. That is erythrodermic psoriasis, in which all the systems
Mm,
of the body, the heart, the kidneys and liver, it can be affected. Okay, so that is an
right.
emergency. So when we get a patient admitted for erythrodermic psoriasis, that we are supposed to treat him or her as an emergency case. That is an emergency. Dermatology has very less emergencies. It is a cool and calm branch, but there are some conditions like drug allergy, like erythrodermic psoriasis, that is emergency for us.
Right. Now, doctor, what can be the cause behind it?
Yeah. So first of all, for most important, psoriasis has a genetic cause. Okay. It can be it's an autoimmune thing. Okay. Antibodies are being formed against one's own skin. Because of that, psoriasis is occurring. It is an autoimmune thing. So there can be environmental factors. There can be genetic factors. Certain drugs intake can lead to psoriasis. Trauma can lead to psoriasis. Yes.
Right. What about medications, doctor? Can over-the-counter medications also somehow cause the condition?
Yes, there are certain medications like beta blockers, antihypertensive medications. They trigger psoriasis. Okay, so that history is very important when we are treating a case of psoriasis, to identify whether it is drug related or it is a genetic, or it is familial.
Right. Um, Now, the main thing which comes to our mind when we are talking about any skin condition is it contagious? So, what about psoriasis? Is it contagious, doctor?
Not at all. Psoriasis is not an infection. It is just a condition. Rather, we can say it is an inflammatory disorder. It's an autoimmune disorder. So it is having autoimmune etiology. So it is not contagious
Mm-hmm.
at all.
Right. Let's dive into the next question now. I think everybody will be wondering, before we dive into the latter part of the live, doctor, if you could please bring a sign of relief for all the people who are watching us right now. Can it be cured?
See, the saddest part is whenever some patient come to us, we tell them with uh, we also don't like to tell, but then we have to tell them the fact that psoriasis is
Mm-hmm.
treatable. It is not curable. We have to tell them. Okay, and we have to counsel them in such a way that they get convinced with this thing. And it is the truth thing. It is not an infection. If it would have been a fungal infection, then we would have treated it. We would have been more happy than patient. But unfortunately, we can't cure psoriasis. We can treat psoriasis.
Right, right. Speaking of treating psoriasis, doctor, what are the treatment options which are currently available for our patients?
Yes. So treatment options, there are first line, second line, and third line of management. So first line of management, we can start with topical medications, which involves topical corticosteroids, then topical calcineurin inhibitors like tacrolimus or pimecrolimus, then topical vitamin D analog medications. You can start with that. Okay. Apart from that, we can
Mm-hmm.
include emollients in the emollients in the medications. So yes, we can also go with that. Then we can ask the patient for lubrication, that is application of oil 30 minutes before bath, and then application of Vaseline petroleum jelly. Maybe we can give after all the daily routine is done at night before sleeping. So that is the first line of management. Again, it depends upon the severity and the involvement area of the disease, okay, and the site of the disease. So that is there. Second thing is second line of management. We can start with oral medications like oral acipretine, or we can start with oral cyclosporin in that. And third line of management, sure, we can go with the biologicals like adalimumab or infliximab. Yeah.
Right. Now, as you said about medication, doctor, how long does one needs to continue this medication for?
See, medications is like it totally depends upon. I said you about the. It depends on the severity. So,
Right.
depending upon the severity, we have to take a call that how long the medications will be going for the patient, and when we have to shift it to the conservative line of management, like only on emollients and applications, topical applications. So in that case, see, patient need not need to take one particular medicines for entire life. Okay, but yes, we
Mm-hmm.
have to keep follow up of the patient to decide.
Right. Now, moving ahead, doctor, towards the next question, which is the triggers for psoriasis. What are the things that can make it worse?
See, weather conditions make psoriasis quite worse. So first of all, it will be, and also the history taking, proper history taking with the patient. If he's an antihypertensive patient, he's already on beta blockers, and then we are treating him for psoriasis, then he has to be informed that a little bit the psoriasis might get worse if because he's already on the antihypertensive medications. Okay, and also weather conditions, like it is going to get worsen in winters. It is going to be controlled in
Mm-hmm.
hot and humid climate, and it is going to get worsen in winters. So before winter starts, the patient has to make some measures in which the it means prevention, it will be better than cure. So
Right.
preventive measures has to be taken. Application of moisturization is very important. Emollients application is very important. So that we have to start before the winters come. Even the patient is not
Right.
having any signs and symptoms, then also if he's a psoriatic patient, we have to get him or her to the prevention modalities.
Right. Speaking of prevention, doctor, what if somebody is uh, in her or his early stage of the condition? And as we know that as through this medium, we are trying to educate people about the condition, how it looks like, the formation, so that um, in the initial stage, you can visit the doctor. So, what if somebody has identified the condition in the initial stage? Is cure possible in such scenarios?
See, cure is not possible in any scenario. Okay,
Mm,
psoriasis cure, but psoriasis we can continue completely get it under control. Okay, so
right.
it is like diabetes. Like diabetes, we
Mm,
can't cure diabetes. We can control diabetes. Okay, so it can be
mhm.
totally related to diabetes. So in that case, we can control psoriasis. We can't cure psoriasis.
Right. Now, as you mentioned about diabetes, doctor, what if the patient is diabetic? The patient who is suffering from psoriasis, the patient is diabetic. As we know that diabetes can has a tendency of making any condition or any cuts or any whatever, any health issue worse. What about
Correct. Yes.
psoriasis? Can it also worsen the condition?
Yes, absolutely. See, diabetes and psoriasis, they basically they share the common inflammatory markers like interleukin 6 and C-reactive proteins. So they have the common
Mm,
pathway. So the diabetic patients, we can say they are more prone for having psoriasis or the vice versa. Psoriatic patients are more are
mm,
likely to get diabetes in some of the other time. So that these two things are interrelated because the pathway, the inflammatory pathway, the pathogenesis between all between these two is the same.
mm,
Okay, so we can
right,
relate these two conditions very well. All right, and
right,
again,
right.
psoriasis is a dry condition. Okay, it is like unless
Mm-hmm,
and until we have pustular variant, there is a pustular variant also, but then it first initially manifests as a dry condition. Okay, so
right,
in diabetes there is already dryness of skin. Okay, so because of that also psoriasis it can be triggered. And also
right.
most important thing is the insulin resistance, which is occurring in both diabetes and psoriasis both.
Right. Now, also tell us, doctor, we know a lot of people has a tendency of delaying the condition. What if somebody is delaying the condition on a regular basis? He or she is thinking ki, just a normal moisturizer, a normal skincare would do the work maybe. And application of such skincare regularly on the skin is happening. Uh, how can the condition get worse? The worst case scenario, basically.
Yes. So the the local moisturizers which are which are available in the chemist shop. If the patient go and take
Mm-hmm.
that moisturizer, so it is not going to actually help the patient because we need a ceramide containing moisturizer. Okay. There are
Mm-hmm.
certain ingredients which we have to look in the moisturizer when we are buying a moisturizer. Okay, and
Right.
more than better if a doctor is prescribing, then it is all. better thing, because some people might require a urea containing moisturizer, some people might have irritation to urea. Okay, so in that case,
Mm-hmm.
depending upon the psoriatic lesions, we can decide whether a ceramide based moisturizer is important for the patient or a urea containing moisturizer is better for the patient. Okay, so proper consultation is very very important when we are going for moisturizer. It is not that moisturizer हाँ चलो कोई भी उठा के लगा लेंगे सब कुछ ठीक हो जाएगा. Like this, it is not going to
Mm,
happen. It is going to more make the psoriatic lesions worse. It is going to create allergy in that, and again secondary infections. Yes, so we need to really really think before going for moisturization also. It is very important step.
right. Now let's once again know the major areas which are normally seen to be affected by psoriasis. As you mentioned, the elbows are the one. What are the other places? The scalp is the one, as you mentioned. Nail psoriasis. We'll also talk a little bit about it. Can you please explain about those, doctor?
Yes. See, nail psoriasis, nail is a very, very important and the most common organ which is affected with psoriasis. Okay. So,
Mm-hmm.
in the nail, we have proximal, intermediate, and distal matrix. Okay. The nail bed involvement is there. So, what is happening basically in nail psoriasis? Splinter hemorrhages are occurring. Small pore spits are happening. Okay. Onychohexis means splitting of nail is happening. Onycholysis, that is splitting of nail from the nail bed happens. Subungual hyperkeratosis is occurring. Salmon patch, which is characteristically oil drop sign, which is seen on the nail bed. So the nails basically they become brittle. Okay, patient says that nails
Mm,
आराम से निकल के आ जाते हैं डॉक्टर, बहुत ही टूट रहे हैं. Okay, so the nails are going, they are commonly getting affected in this thing. Leukonychia, that is white appearance of white nail, that is happening. And the lunula, this
mm,
just below the nail, we are having a small portion, this curved portion. This turns to be
right.
red in color.
Right.
So this is lunula.
Okay.
So that is also commonly seen in psoriatic psoriasis if it's involving the nails.
Right. So, is this condition anyhow painful, doctor? Is it pain induced?
Yes, it is painful if it is infected with secondary infection also, and the patient is
Mm,
scratching. Okay, if the patient is scratching, then small pinpoint bleeding can occur. That in medical terminology we say hospital sign is positive. So so small pinpoint bleeding can occur, and yes, it is painful. Itching is slight less in psoriasis. Itching is not that more as it is seen in fungal infections, but itching is
mm,
there, but it is very less. But yes, pain it is there. Also, the joints of hands and legs, they can be affected.
mm-hmm.
That is psoriatic arthritis, which we call. The
Right.
patient, when we have to diagnose a case of psoriatic arthritis, we have to say that ki just move your joints. Okay, if the patient complains
Mm,
of joint, and also if it is involvement of the metacarpal area or the metatarsal area, then generally there will be joint involvement in more than 50-60% of the patients.
right.
So
Let's talk a little bit.
X-ray is
Yes.
advisable.
Yes, doctor, you were saying.
Yeah, sorry to interrupt, but X-ray is really advisable if the metacarpal and the metatarsal joint areas are involved. The skin lesions are present, then we generally advise a X-ray to rule out psoriatic arthritis in initial stages so that they can be cured and the disease don't get worse.
Right. So, let's talk a little bit more about this psoriatic arthritis as you're talking about. The occurrence of it. Is it something like the person is suffering from psoriasis and he or she is not getting himself or herself treated, and maybe it is penetrating inside, deep inside the skin? Is it something like that, or the formation it happens in a different way?
Inflammatory condition, it is going and triggering the joint areas. Okay, so
Mm-hmm.
because of that the patient might have difficulty in moving the joints, right? So for that thing, early diagnosis and treatment is very important in case of psoriasis, otherwise the patient might have a deformity.
Right. So, in such cases, is the pain only internally, or they can also see such external changes on their skin in the
Yes,
case of
they can
psoriatic arthritis?
yes, they can have external changes that can be plus or minus. They can have external
Mm-hmm.
changes, or they can, or only the joint involvement can be seen. either of the
Okay,
cases.
okay, okay. Doctor, any other organs that psoriasis can affect apart from the joints?
Psoriasis, yes, psoriasis can affect the, as I rightly said, it can have a cardiovascular risk, like erythrodermic psoriasis,
Hmm.
if we talk. So it is an emergency condition, fine. So in that case, the kidneys can be affected. Okay, the protein level goes down, that we call hypoproteinemia. Patient might have fever in that case, so they are losing more and more proteins is. And also the heart involvement can be there, ventricular fibrillation can be accompanied with uh, when the heart is involved. Okay, then again the central nervous system also gets affected. Okay, so every organ can be affected because of psoriasis if it is a systemic involvement. Yeah.
Right, right. So delaying this condition and not getting yourself treated is definitely not the solution, is not what we would suggest. Get yourself treated, get yourself checked in the initial stage. I think that's the best thing you can do to yourself. Doctor, the scalp psoriasis we were also talking about. Now, scalp is one of the place which becomes very hard for us to figure it out, or when we are treating, because hair is present there. Tell us something, doctor. What if somebody is suffering from scalp psoriasis? Um, can hair fall be seen in such cases?
Absolutely. Because of dryness and itching and involvement of erythematous plaque, the hair bulbs can be destroyed. Okay. In that case,
Mm-hmm.
there might be significant hair fall, right? And also there may be patchy hair loss also.
Right, right. So, not confusing it with any other health condition or dandruff being one of the major
We have to
reason.
rule
Please do
it out.
not confuse
Right.
it.
I would like to add a
Right.
point on that. Normal dandruff
Yes,
will
sir.
occur likewise disperse, okay? Disperse in
Mm-hmm.
overall entire area of the scalp. But psoriatic involvement can occur at particular place mostly anywhere on the
Mm-hmm.
scalp, but on a particular focused area. There might be a silvery
Right,
white plaque, erythematous, initially with a spapule and progressing towards a plaque. And when you try to
right.
scratch it, or when you try to do a Gadates test, when we do what we do in our OPD, then small pinpoint
Mm-hmm.
bleeding comes from that. So that is a diagnosis of scalp psoriasis. Also, the patient might have corona radiata. That is, the psoriasis can come uh, on this border area, just below the border of our hairline, and
Right,
also it might
right,
involve the behind the ears. Okay, the occiput area also. Okay, just below the
right.
hairline, you can see a small. We should not confuse it with the fungal infection. We should rule out fungal infection in case of scalp psoriasis also.
Right. Now, today we are talking about treatments which we offer. But doctor, we also know that there are a lot of other treatments available in the market, which people claimed to be, useful and effective. And I know a lot of people who did mostly does not wants to go for allopathy. They try to offer homeopathy because of the less side effects, maybe, let's say, or ayurvedic maybe. So does such treatment also work for the case of psoriasis, doctor?
See, truly speaking, I am a MBBS and a dermatologist after that. Okay,
Mm-hmm.
DDV after that. So I have been trained in allopathy. I have not been trained in Ayurvedic or homeopathy. So I'm really sorry, I can't comment on that. There might be there might be good treatment options in that specialty also, but I don't have any knowledge because I haven't studied homeopathy and I haven't studied Ayurvedic. So I can't comment
Right,
on that thing. Yeah.
right. But tell us, doctor, does these treatments that we go for, the allopathy treatments, does it also have any side effects?
Yes, allopathic, every medicine is going to have side effect. May it be allopathy,
Mm,
may it be homeopathy, or any medicine. I'll talk on allopathy. It is going to have side effects. It is going to have dryness of skin also. So it is going
mm,
to involve the other areas also, or other systems also of the body. So repeated health checkup, repeated lab
right.
monitoring also we have to do with that. Yeah.
Right, right. So being in touch with your doctor uh, throughout, especially when you're suffering from psoriasis. As we by now, we know that this is a condition which is going to be with you forever. So you have
Yeah.
to understand this, that this is not going anywhere. It's going to stay with you. It can be controlled. It can be managed, it can be treated, can't be cured. So you have to be in touch with your doctor, your expert. Now, moving ahead, doctor, what about lifestyle changes? Any lifestyle changes one should take in the case of psoriasis?
Yes, lifestyle modification is very important. As I said that it is having a very very close relation with the diabetes. Okay, so we have to keep our weight under control. Fine. So this
Mm,
lifestyle modification is very important. Again, after that, so psoriasis is having a very great impact on the psychological effect. It is
right.
having a great psychological effect on the patient. So stress has to be managed. Certain practices has to be done in which there should be management of stress, like practicing yoga sessions and proper exercise
Mm,
and meditation. That is very very important, because again it is going to increase the neuropeptide. It actually basically it decreases the neuropeptide degradation enzyme. Because of that, it is
mm,
decreasing the enzyme, so the enzyme is not able to go and bind with the neuropeptide, so the neuropeptide increases. Because of that, the anxiety and the depression things are happening. So stress
right.
management is very very important. Maximum it should be, it is seen in psoriatic patients, they're very very depressed because of itching and all. They're irritable also, but they're this has to be managed. Yes.
Right. Um, well, what about diet, doctor? Any changes in our food habits one should take in the case of psoriasis?
Yes, yes, fine. Diet modification is also very important, and like patient should be having a vitamin D rich diet. Okay, in that case, also we add supplements like vitamin D when we are prescribing in our
Mm-hmm.
medications to our patients, and also proteins has to be taken well. Okay, after kidney function test is done, that is also going to improve psoriasis. It is going to it is going to not actually improve psoriasis. Medicines and emollients are going to improve psoriasis, but they are going to be an adjuvant therapy.
Right, right. Now, quickly, doctor, let's take few questions from the viewers, which our viewers are asking. The first question comes from Avdesh Tiwari asks, what is the best moisturizer for psoriatic condition?
Just 1 minute, huh, madam? Just 1 minute.
Sure. Well, people who are watching us right now, thank you so much, everyone, for joining us. I can see a lot of questions coming up from our viewers. Make sure you are commenting down your questions, whatever you want to ask regarding the condition from our doctor today. We are in discussion with Dr. Prachi Prashant Mahajan, and on a very, very important topic, we are having this discussion. Topic is psoriasis, and we see a lot of people suffering from the condition, being hampered, as already discussed, that um, people are genuinely mentally hampered by the condition. So yeah, we are discussing all the needful today regarding the condition. Please make sure you're commenting down with your questions.
Yes, I'm back. Yeah, sorry.
Yeah, doctor. So yeah, the question was, what is the best moisturizer for psoriatic condition?
Best moisturizer is like a ceramide containing moisturizer is very good. Fine. So and also depending upon the condition, urea based moisturizer it can be added in psoriasis is depending upon the severity. Fine. Yeah. So it totally depends on the psoriasis which moisturizer has to be used.
Right. The next question, doctor, comes from Deepak Saxena asks, how do I know which treatment is best for my psoriasis?
See, actually, doctor has to decide. Doctor has to take a call to which is the best treatment. So patient can't decide likewise which is the best treatment for psoriasis. So consultation is very very important, and then we can
Right,
decide that which treatment will be better.
right. Right. So, Deepak, I believe consulting your nearest expert can help you out regarding the matter. The next question comes from Usha Patel, who asks, my friend told me that my psoriasis is more likely caused by stress and gluten in my diet. Is it true?
It is caused by stress, and gluten is, yes, it might be a causative factor, but yes, uh, इट इज नॉट द ओनली थिंग कि स्ट्रेस की वजह से सोरियासिस होगा. यस, सोरियासिस की वजह से स्ट्रेस हो सकता है. द वाइस वर्सा इज
Right.
ट्रू.
Right. Well, the next question comes from Gitika Sharma, who asks, areas of my skin recurrently gets red and scaly. So, do I have psoriasis?
That is basically a clinical diagnosis. Okay, so we need to really, you need to really consult a dermatologist, so that after performing certain bedside tests we can come to a conclusion, or if either a biopsy, if it is required, then a biopsy can also um, diagnose psoriasis. But psoriasis is mostly a clinical diagnosis, so consultation is very very important to diagnose the
Right.
psoriasis.
Right. Doctor, is it possible that one fine day, a person who is suffering from the condition, he or she sees that the condition is slowly and gradually like going away, and the person is getting cured? Are such cases also seen?
Pardon, sorry, I didn't get it.
Yeah, the question was, is it possible that a person who is suffering from the condition, slowly and gradually the condition uh, like leaves the body, or it's gone forever? Can such cases be also seen?
Yes. See, psoriasis is not going to go from the body. Okay. It is an
Mm-hmm,
autoimmune condition. Okay. If it is drug induced, then when we stop taking drugs, then it might get cured. But then
mm-hmm,
some of the other traces are going to still be in the body. May the disease might not be in manifested. The patient might not have signs and symptoms of psoriasis, but yes, the psoriatic genes which the persons are having activated, the autoimmune thing,
mm,
it is going to be for the rest of life. But yes, it can be taken controlled. It can be completely taken under control.
right. Doctor, as you said, genes are involved in this condition. So, what if a person knows that somebody from his or her family is suffering from this condition, and he or she is more likely to also suffer from the same? Any preventions for such people?
See, it is not compulsion that if my parents or my brother or sister is having psoriasis, then I might have psoriasis. It can be
Mm,
or it cannot be. Prevention is like we can't actually do anything before that. Okay, and patients just don't do. They just have to keep their skin very much moisturized if it is dry
mm,
skin. Yes. So if there is a parent history of psoriasis, or near sibling or close relative having psoriasis, moisturization is a key if the skin is dry. So that
right.
just can have some effect. But then if psoriasis is going to occur in that particular patient because of autoimmune thing, then it is going to happen only. Okay, because we
Right.
can't change the autoimmunity. We can't go against nature, so we can't change the autoimmune antibodies and everything. That advancements still have not been there. Okay, so
Mm-hmm.
we need to accept that we are having psoriasis, and then we need to work accordingly, and then we can lead a better
Right.
life if it is kept under control.
Right. And we have the last question, though we know the answer, but we have the last question coming up from Khan Danish, who asks, what is the best medicine for psoriasis? One of my relative is suffering from it for the last 5 to 6 years.
Yes, we actually best medicine. There is nothing best. There is nothing worst. It totally depends on your disease condition, and it is depending on your involvement. How much the psoriasis is involved in your body. You can have topical medications also as a best treatment, or just a moisturization. Just a routine just following a routine is going to make your psoriasis under control. Or else you might require excimer laser to cure your psoriasis. Phototherapy is advised.
Hmm.
Then biologicals, if in severe cases, we have to take help of biologicals medicines like adalimumab, or else topical medicines like immunosuppressants, tofacitinib, that we can take into consideration. So it totally depends upon how much area, and also how much disease severity is there of your
Right.
psoriasis.
Right. And we have another very interesting question. I believe this is the last question. Comes from Ria Mishra, who asks, does manicure also cause psoriasis, or maybe nail extensions, which girls are very fond of nowadays? Can it also cause the condition, doctor?
No, not at all. Psoriasis is actually is an autoimmune condition, and it will not occur because it's an inflammatory condition. Little bit of irritation, little bit of eczematous changes can occur, but manicure, it is not going to cause psoriasis.
Right. Well, that was a very, very informative session today with Dr. Prachi. Doctor, before we take a leave, any take home message for our viewers who has watched us so far?
Yes. So whenever the patient come to us of psoriasis, that time I told earlier also, with a heavy heart, we have to say to the patient, first line, we have to tell the patient the fact that we can control your psoriasis, we can treat your psoriasis, but we can't cure your psoriasis. That is a very important thing that we have to say, because in patient is like कि डॉक्टर इससे छुटकारा कब मिलेगा. So इससे
Hmm.
छुटकारा तो नहीं मिलेगा, but you can lead a better life, you can lead a better your life can be better if you are taking psoriatic seriously. Okay, not seriously, but taking proper medications, consulting your doctor, and going in right path. Otherwise it is going to be worse and worse and worse, and it is going to cause other psychological stress in patient. And also if the patient is stressful, then the relatives, the family members also are stressful. So yes, psoriasis is treatable. Anybody is having psoriasis, please consult your doctor, and then you can lead a better life, you can lead a good life after proper treatment.
Well, that was the expert advice for today, and that was Dr. Prachi Prashant Mahajan for us. Thank you, doctor, for your valuable time. It was really, really very informative for our viewers, and it was great to hear from you once again. We look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation in today's session. Stay connected to our channel, and do not forget to subscribe to our channel, Radiance with You. Thank you. You all stay
Thank
safe
you,
and
thank
stay
you,
healthy.
thank you. Yes, thank you.